belly breathing versus foundation training's decompression breathing. The blue pegs represent the ribs, the rubber bands are the fibrous part of the diaphragm, and the central piece represents the central tendon and the crura, where the diaphragm attaches to the spine. During a belly breath, the rib cage remains still, so as the fibers of the diaphragm contract, they pull the central tendon downward into the abdominal cavity. This increases space in the thoracic cavity to allow the lungs to fill with air, and it significantly increases abdominal pressure below the diaphragm. Pressure will always push outward to the points of least resistance. If there's a weakness in the abdominal region or the pelvic floor, as is often the case post-pregnancy, this type of breath will push out and down into these vulnerable areas with every single breath. During foundation training's decompression breathing, the central tendon stabilizes and the rib cage pulls away from center in all directions. This creates space, mostly laterally, for the lungs to fill with air. And while there's a little bit of depression of the central tendon, it's minimal compared to a belly breath, and therefore there's significantly less of an increase in intra-abdominal pressure.